Why are dental implants such a life-changing solution for people with missing or failing teeth? Because the loss of teeth has so many negative effects on a person's life. There's loss of chewing ability and the resultant poor diet, leading to poor health, or at least the inability to optimize health. Pain which in some cases can be debilitating, decreasing a person's ability to work and be productive in their life, having them spend time trying to get over an acute exacerbation of a chronic infection, having to take medicines, lost work time, and playtime. Systemic health effects that are caused by bacterial infections around bad teeth, including heart disease. Several studies show that a direct link between chronic periodontal disease or infection around a tooth and heart disease. I've seen many cases of this in my office. Often after taking out bad teeth, patients feel more energy. They feel like a weight has been lifted. The burden of fighting that infection around the teeth is finally removed, and they feel younger and more vibrant. The loss of the ability to smile, in many cases if you lose a tooth that's visible when you smile, or just have continued progressive damage to those teeth, and the smile starts looking worse and worse, patients tend to not smile, and lack of smiling has a huge psychological disadvantage. The bad experiences I have heard about with implants include spending a lot of money to get an implant done and a lot of time only to have that implant fail. My goal is to have implants last a lifetime. The mistakes I see most often happening at other implant centers is poor placement of the implants in the bone. If the implant's not positioned correctly, they are difficult to restore. And if compensations have to be made in the restoration or the other teeth that go on the implants, then it has more probability of failure. Several times I've seen devastating mistakes made with dental implants, and that is using cheap parts on top of a good implant, because the parts are not made to the specifications of the implant design. They can't withstand the forces that are put on them, and they can break not only the part itself, but also the implant. At my office, we use the best implants, and the parts attached to them are made to the specifications of those implants. If you want things to last, you've got to build it right. Many people hearing that implants go into the bone think it's a very painful procedure. But studies were done a long time ago that showed that putting an implant into the bone is no more painful than a simple extraction of a tooth. Other reasons people are hesitant to get implants is because they're worried about having a titanium post in their jawbone. They think that there could be a reaction in the bone or that it won't feel right. The truth is that titanium is very well accepted by the body, and now all joint replacements and components to fix fractured bones are all titanium, because it's such an excellent material that the body really likes. Cost is another factor people are hesitant to get this kind of work done. We work hard to explain all the costs in advance and give our patients many different financing options. At Reynolds Oral and Facial Surgery, our approach to dental implants is to place the very best implants in the very best manner so that we can have a long-lasting result with beautiful smiles and excellent function. Each one of our restorations is custom designed for that patient, as are all of the placement of the implants. In addition to that, there are many other factors in each person's life that determine which plan will be used. We do our best to get to know our patients and to help guide them to make the best decision that will be the best for them.